12 prohibited foods for gastritis, heartburn, and gastroesophageal reflux. Do you experience stomach pains that appear after meals? Have you tried countless remedies and tips but still haven't found a permanent solution? Could the foods you consume daily be the real villains for your digestive health? Gastritis, acidity, heartburn, and gastroesophageal reflux are conditions that affect millions of people. These conditions, although common, can cause significant discomfort and, in more serious cases, serious complications for your health. But do you know what's behind these unpleasant sensations? It is possible that seemingly harmless habits are compromising your quality of life. Today, we're going to uncover the main foods that could be sabotaging your stomach. Find out which ones to avoid to reduce gastritis, combat acidity, and prevent reflux. Let's get started. The foods that seem harmless but destroy your stomach. Often, the foods we consume daily go unnoticed as possible culprits for gastric discomfort. That irresistible fried food, the essential coffee, or even a seemingly healthy fruit juice can be real villains for your digestive health. Gastritis, acidity, and gastroesophageal reflux are conditions that do not arise only due to extreme habits or excessively harmful diets. Small daily choices, such as consuming foods rich in fats, refined sugars, or acids, can aggravate the gastric mucosa and cause symptoms such as pain, burning, and heartburn. For example, processed foods full of preservatives and dyes overload the digestive system and compromise the natural protection of the stomach. Concentrated sweets and fried foods are other examples that, in addition to causing discomfort, increase the production of gastric acid, favoring problems such as reflux and gastritis. Furthermore, we often ignore the impact of eating habits. Eating quickly, skipping meals, or consuming large amounts of food in a single meal can intensify symptoms and make it difficult for the stomach to function properly. Identifying these foods and their impacts is the first step to adjusting your diet and relieving symptoms. Are you making these mistakes without realizing it? Next, we'll detail which foods are the main villains and how avoiding them can transform your digestive health. What causes gastritis, acidity, and reflux? Gastritis, acidity, and reflux are caused by a combination of factors, ranging from inadequate nutrition to more complex issues, such as infections and hormonal imbalances. Gastritis, for example, is often the result of inflammation of the gastric mucosa, which can be triggered by excessive consumption of irritating foods such as spicy foods, fats, and alcoholic beverages. However, the impact is not just external. The bacteria Helicobacter pylori, it is one of the main causes of gastritis, creating inflammation that can develop into more serious problems, such as ulcers. Acidity and gastroesophageal reflux often occur when the valve that separates the stomach from the esophagus, the lower esophageal sphincter, does not work properly. This allows stomach acid to move up the esophagus, causing the burning sensation. Factors such as obesity, stress, and large meals before bed can aggravate this condition. The modern lifestyle, with fast meals, processed foods, and little care for the quality of the diet, is largely responsible for these conditions. Skipping meals, eating fatty foods, and abusing drinks such as coffee and soft drinks can intensify symptoms and make recovery difficult. Understanding what causes these problems is essential to preventing them and treating symptoms effectively. But is it possible to reverse the damage they have already caused? The answer is in the next topic. Is it possible to reverse the damage caused by these conditions? The good news for those suffering from gastritis, acidity, or reflux is that, in many cases, it is possible to reverse the damage caused by these conditions, especially if the diagnosis is made early and the correct measures are taken. The first step is to adjust your diet. Avoiding foods that irritate the gastric mucosa, such as fried foods, spicy foods, citrus juices, and alcoholic beverages, is essential. Replacing them with foods rich in fiber, such as vegetables, legumes, and less acidic fruits, can speed recovery. Additionally, adequate hydration is crucial. Drinking plenty of water throughout the day helps balance gastric acid production and keeps the digestive system working properly. Soothing teas, such as chamomile, can also help reduce inflammation and discomfort. In cases where the bacteria Helicobacter pylori is present, specific treatment with antibiotics prescribed by a doctor is necessary. This treatment is effective in eliminating the bacteria and preventing more serious complications, such as ulcers or even gastric cancer. Lifestyle changes also play an important role. Avoiding large meals, not eating before bed, and maintaining an ideal weight are measures that can significantly reduce symptoms and prevent new episodes. While reversal is possible, it is essential to act quickly. Ignoring symptoms or delaying treatment can lead to serious consequences. Next, we will see what happens if these problems are not addressed in time. What are the consequences if you ignore these symptoms? Ignoring the symptoms of gastritis, acidity, and reflux can have serious short- and long-term health consequences. These discomforts are often seen as temporary problems, but without adequate treatment, they can evolve into more serious and potentially irreversible conditions. In the case of gastritis, worsening inflammation of the gastric mucosa can lead to ulcers in the stomach or duodenum. These ulcers can cause severe pain, internal bleeding, and in extreme situations, stomach perforations that require immediate surgical intervention. Gastroesophageal reflux, in turn, can cause damage to the esophagus due to constant exposure to stomach acid. This can lead to esophagitis, an inflammation of the lining of the esophagus, and, in chronic cases, Barrett's esophagus, a precursor condition to esophageal cancer. In addition to physical risks, untreated symptoms directly affect quality of life. Constant pain, discomfort after meals, and fear of eating certain foods can compromise emotional well-being, generating anxiety and even depression in some cases. It is important to remember that the sooner the problem is diagnosed and treated, the greater the chances of avoiding serious complications. A correct diagnosis involves carrying out specific tests, as we will see in the next topic. What exams should be carried out to identify problems, such as gastritis? To correctly diagnose gastritis, acidity, and reflux, it is necessary to carry out specific tests that allow the doctor to assess the state of the digestive system and identify the exact cause of the symptoms. The most common test to detect gastritis is upper digestive endoscopy. During this procedure, a thin tube with a camera at the end is inserted through the mouth into the stomach, allowing the doctor to view the gastric lining and identify signs of inflammation, injuries, or ulcers. In some cases, a biopsy is performed, in which small fragments of stomach tissue are collected for laboratory analysis. Another relevant exam is the test to detect the bacteria Helicobacter pylori. It can be carried out in different ways, such as blood tests, respiratory tests, or stool analysis. Identifying the presence of this bacteria is crucial to starting appropriate treatment with antibiotics if necessary. Additionally, imaging tests, such as a barium contrast X-ray or abdominal ultrasound, may be ordered to assess the functionality of the digestive tract and rule out other conditions. In cases of severe reflux, esophageal pH monitoring, which measures the level of acidity in the esophagus, is often recommended. These tests, although simple, are essential for an accurate diagnosis and planning effective treatment. With the results in hand, it is possible to adopt personalized strategies to alleviate symptoms and avoid complications. Now that we understand the importance of diagnosis, let's explore how specific foods directly influence your digestive health. Spicy, how they turn your digestion into chaos. Spicy foods are among the most controversial when it comes to digestive problems. Despite being loved by many people, excessive consumption of these foods can turn the functioning of your stomach into real chaos. Peppers, hot sauces, and spices such as black pepper stimulate the production of gastric acid. This increase in acidity can irritate the stomach lining, worsening the symptoms of gastritis and reflux. Furthermore, frequent consumption of very spicy foods can weaken the stomach's natural barriers, making it more vulnerable to inflammation and injury. It is important to highlight that spicy foods alone are not responsible for causing gastritis in healthy people. However, for those who already have symptoms of gastric irritation, they can be like gasoline thrown on a fire, intensifying the burning sensation, pain, and heartburn. A curious factor about spicy foods is that they stimulate the release of endorphins, which explains the feeling of pleasure that many associate with their consumption. However, this pleasure can be costly for those who already suffer from digestive problems. For those who can't give up the spicy flavor, moderation is key. Removing seeds and veins from peppers can reduce their impact, but in cases of diagnosed gastritis or reflux, it is best to avoid them completely. But what about fats? they can be just as harmful as spicy foods. We will explore this in the next topic. Animal fats, the invisible poison you ingest without realizing. Animal fats, present in red meat, sausages, full-fat dairy products, and other foods rich in saturated fat, are often neglected as agents harmful to digestive health. However, these foods can be extremely harmful, especially for those who suffer from gastritis, acidity, or reflux. The problem with animal fats begins in the digestive process. To digest these foods, the stomach needs to produce large amounts of gastric acid. This increase in acid production can further irritate the gastric mucosa, worsening symptoms such as burning and pain. Furthermore, foods rich in fat remain in the stomach longer, delaying gastric emptying and increasing the risk of gastroesophageal reflux. Another worrying point is the indirect impact of animal fats on body weight. Excessive consumption of these foods can lead to weight gain, and obesity is one of the main risk factors for reflux, as abdominal pressure increases, favoring the return of acidic stomach contents to the esophagus. To reduce the impacts of animal fats on digestive health, replacing them with lighter options such as lean meats, chicken, fish, and foods of plant origin is highly recommended. Furthermore, limiting the consumption of fried and processed foods is essential to alleviate symptoms. Animal fats are not the only villains. Drinks like sodas and citrus juices also have a significant impact. Let's find out how in the next topic. Soft drinks and citrus juices, the daily dose that detonates your health. Soft drinks and citrus juices are among the most consumed drinks in the world. But for those who suffer from gastritis, acidity, or reflux, they can be a dangerous trap. Although they are refreshing and popular, their effects on the digestive system can be devastating. Soft drinks, for example, are rich in carbon dioxide, which increases the pressure inside the stomach, forcing gastric contents to rise up the esophagus, causing reflux. Furthermore, the high amount of sugars and chemical additives present in these drinks irritates the gastric mucosa, exacerbating symptoms such as burning and pain. Citrus juices, such as orange, lemon, and pineapple, are equally harmful due to their natural acidity. Consuming these drinks in excess can increase the production of acid in the stomach, worsening the conditions of those who already face gastritis or reflux. It is important to remember that even natural juices, considered healthy, can cause discomfort in people with a sensitive stomach. To minimize damage, it is recommended to avoid consuming soft drinks and citrus juices, replacing them with lighter options, such as water, herbal tea, or less acidic fruit juices, such as apple or melon. Furthermore, drinking liquids during meals should be done in moderation, as it can dilute digestive acids and impair digestion. But the problem doesn't stop with drinks. Another extremely popular drink, coffee, can also be a big enemy of the stomach. We will explore this topic in the next topic. Coffee. Is your morning habit making your gastritis worse? Coffee is one of the most popular drinks in the world, but it is also often associated with digestive discomfort, especially for those suffering from gastritis, acidity, or reflux. Despite being loved for the flavor and energy it provides, coffee can be a big culprit for the stomach. The main problem with coffee is its ability to increase gastric acid production. This effect is particularly harmful for people with already inflamed gastric mucosa, as in the case of gastritis. Additionally, coffee relaxes the lower esophageal sphincter, the valve that separates the esophagus from the stomach. This relaxation allows acid to rise into the esophagus, causing the burning sensation characteristic of gastroesophageal reflux. Another important point is that coffee can directly irritate the stomach lining, especially when consumed on an empty stomach. Many people have the habit of starting the day with a cup of coffee, but for those who already face digestive problems, this practice could be a mistake. Does this mean you should ditch coffee altogether? Not necessarily. There are alternatives, such as decaffeinated coffee or versions in which the acidity has been neutralized. Furthermore, reducing the amount consumed daily and avoiding drinking coffee on an empty stomach are measures that can minimize the damage. However, coffee is just one of the pleasures that can compromise your gastric health. Fried foods, for example, have an even more direct and devastating impact on the digestive system. Let's find out more about this in the next topic. Fried fries, the flavor that comes with a high price for your body. Fried foods are foods that conquer palates around the world due to their unique flavor and crunchy texture. However, for those who suffer from gastritis, acidity, or reflux, these delicacies represent a real danger to their digestive health. The problem with fried foods begins in the preparation process. During frying, the oils undergo high temperatures, forming substances that irritate the stomach lining. Furthermore, fried foods are rich in trans and saturated fats, which slow gastric emptying. This increases the time food spends in the stomach, causing discomfort such as a feeling of heaviness, burning, and reflux. Another impact of fried foods is related to increased production of gastric acid. When consumed in excess, they overload the digestive system, favoring the worsening of conditions such as gastritis and reflux. Foods such as chips, pastries, and fried chicken, although tempting, can cause more harm than good. The solution is not to completely eliminate these foods from your life, but to consume them in moderation and look for healthier alternatives. Baked or grilled preparations, for example, offer a pleasant flavor without the side effects of frying. If fried foods are already harmful, what about alcoholic drinks? In the next topic, we will explore how alcohol can be even more harmful to the digestive system. Alcoholic drinks. Why alcohol can be your worst enemy. Alcoholic drinks are among the biggest enemies of those suffering from gastritis, acidity, and reflux. Although they may seem harmless in small amounts, excessive or frequent consumption can cause significant damage to the digestive system, worsening symptoms and complications. Alcohol is highly irritating to the gastric mucosa. When ingested, it increases the production of acid in the stomach, intensifying inflammation and causing symptoms such as burning, pain, and heartburn. Additionally, alcohol can weaken the lower esophageal sphincter, allowing stomach acid to move up into the esophagus, which intensifies episodes of gastroesophageal reflux. Another harmful effect of alcohol is its ability to interfere with the regeneration of the gastric mucosa. For those who already have gastritis or stomach injuries, drinking alcohol can delay the healing process and worsen symptoms. The most problematic alcoholic drinks are those high in sugar, such as liqueurs and cocktails, as sugar can also aggravate gastric symptoms. However, even less sweet drinks, such as wine and beer, can be irritating when consumed without moderation. If you don't want to give up alcohol, limit your consumption and avoid drinking on an empty stomach. Consuming it with light meals can reduce the impact on the stomach, but moderation is essential. Alcohol is not the only hidden villain in food. Dairy and soy products may also surprise you with their negative impacts. We will understand more in the next topic. Dairy and soy, the foods you need to reconsider. Although many people consider dairy and soy products to be healthy options, these foods can be problematic for those who suffer from gastritis, acidity, or reflux. Depending on individual tolerance, they can trigger or worsen symptoms of these conditions. Dairy products, especially full-fat dairy products, are high in fat, which can delay stomach emptying. This increases pressure on the digestive system and promotes gastroesophageal reflux. Furthermore, the lactose present in milk and its derivatives can be difficult for some people to digest, causing discomfort such as bloating, gas, and abdominal pain, which can worsen the symptoms of gastritis. Soy-based products, such as tofu and soy milk, may contain compounds that irritate the gastric lining in more sensitive individuals. Additionally, many commercial versions of these products contain additives and sugars that can also harm digestive health. If you notice that dairy or soy products intensify your symptoms, consider replacing them with milder alternatives, such as almond or coconut plant-based milks, which have less irritating potential. Furthermore, prioritize versions without additives and prefer to consume them in moderate quantities. Understanding how these foods affect your body is essential for adjusting your diet and avoiding discomfort. But the impact of concentrated sugars and sweets can be even more surprising. We will explore this in the next topic. Concentrated sweets, how sugar feeds your symptoms. Concentrated sweets, such as chocolates, cakes, pies, and other foods rich in refined sugar, can be a real balm for those suffering from gastritis, acidity, or reflux. Despite pleasing the palate, these foods have a significant impact on the digestive system. Refined sugar is known for causing energy spikes followed by rapid crashes. But what many don't know is that it also directly affects the stomach. When consumed in large quantities, sugar can alter the natural balance of bacteria in the digestive tract, favoring the growth of harmful microorganisms, such as bacteria. Helicobacter pylori. Additionally, sweets rich in fat and sugar, such as commercial chocolates and heavy desserts, increase the production of gastric acid and delay stomach emptying. This combination not only intensifies the symptoms of gastritis, but also increases the risk of gastroesophageal reflux. One way to minimize damage is to opt for more natural and less sugary versions, such as dried fruits or chocolates with a high cocoa content, 70% or more. Still, consumption should be moderate. If you suffer from gastric discomfort, it is essential to identify which sweets trigger your symptoms. Replacing these foods with lighter options can make all the difference to your well-being. But what about seemingly harmless foods like vinegar and chocolate? They also play an important role in worsening these problems. We will explore this in the next topic. Vinegar and chocolate. What you need to know before consuming. Vinegar and chocolate, two popular items in many people's diets, can be a real challenge for those facing gastritis, acidity, or reflux. Despite having their benefits in other areas of health, for the digestive system, the consumption of these foods requires caution. Vinegar is an acidic condiment that, when consumed in excess, can irritate the gastric mucosa. This is especially true for people with gastritis or reflux, as vinegar increases acid production in the stomach, exacerbating symptoms like burning and pain. Additionally, the vinegar present in commercial preserves and sauces is often combined with other irritating ingredients, such as salt and spices. Chocolate, although widely appreciated, poses risks to the digestive system. Most commercial chocolates are rich in fats and sugars, two components that slow gastric emptying and increase the risk of reflux. Furthermore, cocoa contains caffeine and theobromine, substances that relax the lower esophageal sphincter, facilitating the return of gastric acid to the esophagus. If you don't want to give up these foods, it's important to consume them in moderation. In the case of vinegar, prefer small amounts and opt for natural versions, such as organic apple cider vinegar. As for chocolate, choose options with a higher cocoa content above 70% and a lower amount of sugar. With these precautions, you can avoid worsening your symptoms. But what about processed foods, so present in modern everyday life? Let's find out why they are one of the biggest villains in the next topic. Processed food. The modern food you should say goodbye to. Processed foods are everywhere, from snacks and fast food to frozen meals and processed cookies. Although they are practical and convenient, these foods represent a great risk for those suffering from gastritis, acidity, and reflux. The main problem with processed foods is their composition. They are rich in preservatives, artificial colors, saturated and trans fats, as well as high levels of sodium and sugar. These ingredients not only irritate the gastric mucosa, they can also trigger excessive acid production in the stomach, worsening symptoms such as burning and pain. Furthermore, processed foods are generally difficult to digest, overloading the digestive system and delaying gastric emptying. This slow process can intensify gastroesophageal reflux, as it increases pressure in the stomach and favors the return of gastric contents to the esophagus. Another worrying factor is the impact on the bacterial balance in the digestive tract. Industrialized foods, rich in chemical additives, can negatively affect the intestinal microbiota, creating an environment conducive to the growth of bacteria, Helicobacter pylori. Replacing processed foods with fresh, homemade meals is one of the best strategies for protecting your stomach and improving digestive health. Prioritize natural ingredients, such as vegetables, fruits, and whole grains, which help alleviate symptoms and promote faster recovery. But what about citrus fruits, which are also considered healthy? Do they also need to be avoided? Find out more in the next topic. Citrus fruits. Small doses, big consequences. Citrus fruits such as orange, lemon, pineapple, and grapefruit are widely known for their health benefits, especially as they are rich in vitamin C. However, for those suffering from gastritis, acidity, or reflux, these fruits can be a real challenge. Because they are naturally acidic, citrus fruits increase acidity in the stomach, which can worsen irritation of the gastric mucosa. In people with reflux, consuming these fruits can also intensify the burning sensation in the chest and the discomfort caused by the regurgitation of gastric acid. The problem is not just with the fruits themselves, but also with the citrus juices. These juices are highly concentrated in acid, and, when consumed on an empty stomach or in large quantities, can cause even more stomach irritation. For those who already have diagnosed gastritis, orange or lemon juice is generally contraindicated. Does this mean you should eliminate citrus fruits from your diet completely? Not necessarily. Moderation is the key. Some people can consume small portions of these fruits without symptoms, especially if combined with other foods that neutralize acidity, such as oatmeal or fat-free yogurt. If you notice that citrus fruits trigger discomfort, try replacing them with softer fruits, such as apples, melons, or bananas, which are less aggressive to the stomach. Now that we've explored the foods that aggravate symptoms, we'll gather practical tips for preventing and controlling gastritis in the next topic: the definitive guide to overcoming gastritis. Preventing and controlling gastritis, acidity, and reflux requires simple but consistent changes to your diet and lifestyle. Adopting healthy habits not only alleviates symptoms but also helps prevent future complications. The first rule is to avoid foods that irritate the stomach lining. Reduce or eliminate fried foods, processed foods, alcoholic beverages, coffee, and citrus fruits. Instead, opt for fiber-rich foods such as cooked vegetables, whole grains, and non-acidic fruits, which promote digestion and help protect the gastric mucosa. Stay hydrated. Drinking water throughout the day is essential to dilute gastric acid and facilitate the digestive process. Soothing teas, such as chamomile or fennel, are also great options for relieving discomfort. Establish regular mealtimes. Eating every 3 to 4 hours helps prevent your stomach from remaining empty for a long time by reducing acid production. Additionally, choose smaller, more frequent meals rather than large portions to avoid overloading your digestive system. Avoid eating before bed. Give your body at least 2 to 3 hours to digest food before bed. This reduces the risk of reflux at night. Identify specific foods that may trigger symptoms in your case. Everyone reacts differently, so it's important to observe how your body responds to certain foods and adjust them in your diet. Finally, seek medical advice. If symptoms persist, a healthcare professional can perform tests, diagnose the cause, and recommend the most appropriate treatment for your case. With these steps, you'll be on your way to improving your digestive health and regaining your quality of life. Taking care of your stomach is an investment in your overall well-being. Remember that small changes to your daily habits can bring big results in the long term. Don't let gastritis, acidity, or reflux control your life. Take control and prioritize your health. Your journey to healthy digestion starts today. Make conscious choices, listen to your body, and always seek guidance from professionals. Your health deserves all the attention, deserves all the attention, deserves all the attention, deserves all the attention.